Okay, so I think we are about ready to get started here. We've got a few more people joining, but we should probably get going so we can be respectful of everyone's time. Sam, you give me a thumbs up. You got my screen there? Okay, perfect. Hello and welcome to our webinar. So just to let everybody know, the webinar is going to be recorded today. It has already started. To support your privacy, we've disabled everyone's microphones and cameras, and the chat is available if you've got questions. Our team who's with us today will help answer what they can, and then we'll run through all of the questions at the end. Once our presentation is complete, we will share out the recording with the group. So today we're going to be focusing on charting efficiencies. My name is Stephanie, and this is my partner, Sam. We are practice optimization specialists for Healthquest, and thank you for joining us today. So please note the tools or tips and tools shared in this webinar are for demonstration purposes only. While they may align with your clinic's workflows, they're not taken from any specific clinic. This webinar showcases options available to all Healthquest users. All demonstrations are using a test database and test patients. No live patient or provider data will be shared. Just saw a note going through the chat. Everybody, most people can hear me? A thumbs up. Sam, you can hear me? Okay, perfect. So today we are going to be going through AI scribes in Healthquest, some charting tips and tricks, and some billing efficiencies. Okay, thanks everybody. So AI scribes. What is an AI scribe? It's an artificial intelligence program that generates a visit note and other notes like an appointment summary, consult letter, or a referral letter from listening to the conversation between the provider and the patient. Do I need to make changes to my PIA to utilize an AI scribe in my practice? Yes, a PIA amendment may be required. Healthquest does have fillable forms available for both Wellstar's Nexus AI and Tally AI that can be used to generate your PIA amendment. Do I need consent from the patient? Yes, it's recommended that you obtain consent from the patient. Written consent is preferred. Healthquest has a generic AI consent available as an intake form that patients can authorize electronically. Does the entire clinic need to use the same scribe? No, anybody can use whichever one they want. Is there a cost associated with using an AI scribe? Yes, they are subscription-based and available through the Nexus AI website and the Tally website. We will post the links in the chat, but both scribes do have free trials available. These are the only two scribes currently integrated into Healthquest. You can use other ones, but they only work as a copy and a paste. So the first AI scribe that we're going to go through today is Wellstar's Nexus AI. It was integrated into Healthquest in November of 2025 and can automatically create a chart note from your approved visit notes, no copy and pasting required. It has over 35 available languages and over 75 visit templates, including specialties like dermatology, gynecology, internal medicine, and pediatrics. It's got medical dictation currently in beta, and it has full privacy compliance with Canadian data residency and adherence to industry best practices. All data stays in Canada during storage and processing, with all data encrypted at rest and in transit. It can be used on both desktop and laptop computers, but there are no mobile apps available at this time. If, as a provider, you choose to utilize Nexus AI, when logging into Healthquest, you will also automatically log into your Nexus account in the EMR. When you conduct a visit using Nexus, you open your chart for your patient, but you don't need to create a new visit. Start your encounter in Nexus, and when your visit is complete, stop the recording. Review the information generated, and if satisfactory, click Copy and mark Reviewed. A chart note titled Nexus AI Generated Note will appear in the list of patients' chart notes. You can see it does include a disclaimer down at the bottom, noting that there was consent provided and that it was created using an AI scribe. So the other one that we'll talk about today is Tally AI. It was integrated into Healthquest in June of 2024. It contains an ambient scribe, medical dictation, and a medical search. The medical search uses evidence-based sources like Merck manuals, Choosing Wisely, and OpenFDA. It provides screenshots of relevant answers and links to the information. Tally can be used on desktop and laptop computers with iOS and Android apps available as well. You can generate chart notes in English, French, and Spanish, and other languages may be available through their apps. The Healthquest integration has over 25 available languages and more than 20 available templates. Data is encrypted and stored in Canada. Audio files created from visits are deleted immediately once transcribed, and they've got full privacy compliance as well. When conducting a visit using Tally, it works differently from Nexus. Start a new encounter by initiating the recording and conduct your visit as usual. When finished, click Done. Tally will generate the conversation using your selected default template. Next, you'll open your chart note in Healthquest that you want to use for the visit. You can copy content section by section using the copy buttons beside each header, or you can copy it all at once using the button down at the bottom. You can also create additional documents or charting templates from your visit by clicking the Generate button up at the top. So I'm sorry, I know that was a really brief overview of them. We're not doing a live demo on the AI scribes today. So we are going to move on to the charting efficiencies section. The first topic will be autocompletes. They're also known as macros. You may see or hear these terms being used interchangeably. Macros let you use short abbreviations to quickly generate longer text. You can make them as short or as long as you need, and they can be used almost everywhere in the EMR, including charting, WCB Rapid Report, work lists, and referral management. So to create your own macro, go into Setup and then Autocomplete Macro Setup. Click New to get started, and you can assign a code or an abbreviation here. Use the drop-down to select yourself as the employee, or if it's going to be shared amongst the clinic team, use the drop-down blank. And then enter the text that you would like to have populated by your macro in this description field below. You can use this green button to use form fields and pull information from the patient's chart or from the EMR. When finished creating your item, click Save, and it's immediately ready to use. There's no need to log out and back in. Your macros are not case sensitive, so you may see them here where they're entered in lowercase or in all caps. It doesn't really matter either way. If you are creating a macro where you're going to share it amongst the clinic group, it's good to have it as a unique code where you're not going to have people generating the macro by accident. I made one that said new the other day, and every time I typed new, it just created all sorts of weird things wherever I was. So just make sure that you are specific. So to see how the macros work, I'll open up a chart note here. And I can just type it into a box and press spacebar, and the macro will auto-populate. The next piece we'll go through is phrase list. A phrase list is a pre-typed list of commonly used phrases or sentences that can be inserted into a free text field with just one click. So you select the field that you're in, and you can click the items from the expanded section on the side. To create a new phrase list option or update existing items, you go into Setup, Charting Setup, and Phrase List. As you can see here, the phrase list items can be assigned to a specific template and also a specific field. You can also use the doctor dropdown to limit the availability to a singular provider. Click New to create a new item. Use the template selector to pick the template you would like the phrase list item to be available for, and then use this dropdown to pick the field you'd like it to populate in. Type in your information. You can limit it to yourself as a provider if you would like to, or just leave it blank to leave it available for everyone. And click Save. For these phrase list items, you do need to close your charting window and reopen it for those items to be added into your list. go. So autocompletes versus phrase list. Autocompletes are executed with keyboard commands, allowing you to continue your documentation efficiently. Phrase list requires mouse clicks, where you select the ideal phrase. Autocompletes work just about everywhere in the EMR, excluding instant messaging, CDS notification windows, and letters, as letters have their own macros and autocompletes. Phrase list only works in charting. Autocompletes can be customized to the user's preferences. They can be used for single words, phrases, paragraphs, or lists. Phrase list will insert into your chart note as a single text line only. Autocompletes generally require memorization, where phrase list is viewable beside your chart note, separated by field name. So the next thing that I'll demonstrate is copying from previous visits. Sometimes patients return for repeated appointments, such as wart treatments or injections. In these cases, it may be appropriate to copy from a previous chart note. There are two different ways that you can do this. The first way is going to be the ability to copy an entire visit note. So when you click New to create your new visit, use this box down on the bottom right corner to select a completed visit the patient has had before, and click OK. This will duplicate all of the information previously recorded into the visit you've selected. The text will appear in red so that you can review the information and update it as needed. Please ensure that you remove the previous vitals and enter the ones for today if recorded. The other way to utilize information recorded previously is control left-clicking on a field. This will display the history of all of the information that has been recorded in that field for the patient. Find the information that you'd like to use and press copy to have it populate directly into your chart note. Again, review the information and make any updates as needed. The other thing that we can do with control and left click is that we can graph an adult patient's vitals. This is a printable window and it includes a table of the recorded values. I'm just going to switch charts here. So if you're in a pediatric patient and you double click on a vitals field, you'll be able to graph that information on a World Health Organization growth chart. There we go. You can see it trending here. And this again is printable as well. So if your Healthquest does not already do this, you will need to enable the setting by going into Setup, Program Setup, Charting, and use Who PDFs as growth chart background. As you can see, this setting here, it's bolded, which means that it must be enabled by a system admin because it does affect all of the users in the clinic. So those are my charting tips and tricks that I have for you today. I'm going to hand it over to Sam now, and she has some more items to review with you.
Awesome. Thanks, Stephanie. I will take over sharing here. And I am going to go through and share a number of additional features and some more tips and tricks on charting efficiencies. So when you are seeing a patient for the same thing all the time, it would be nice to have some of the text in your chart note pre-filled in. We can do this with chart templates with defaults. To use a template with defaults, click New Chart Note, then select your template format of choice, and then on the right-hand side, it will filter all of the defaults associated with that template. You can have a checklist style note like this postpartum one. The text will appear in red until you click into the box, reminding you to touch on all of these items during your visit. And you can see a couple of double question marks that are highlighted as placeholders throughout the template. Another option is to have a template pull in patient answers from an intake form that they have filled in electronically. This allows for a more intentional face-to-face interaction without having to type during that initial backstory. So this is an online booking intake form. pulling in the reason for visit, what has worked and what hasn't. These answers have been provided by the patient. You can obviously edit, add, remove as you see fit. And the third option for a template with defaults is to have generic text throughout the note where the provider fills in the gaps. This is a diabetes template where you can see those double question marks throughout the whole note. This allows you to tab through to fill in the blanks using the tab key. Some of you may be specialists and not doing chart notes. You may be doing consult letters instead. So this double question mark is also available in the letter templates. So if we go into letters and new, I'm going to select a consult letter. And my first double question marks, I will double click to select. And instead of using the tab key, I will use Shift F2. That will allow you to jump from one to the next to fill in the blanks, completing your letter. So I will close this. And going back to chart templates with defaults, I will show you how to create these within your clinic. I will minimize this charting window. And I am going to go through this somewhat quickly, but the recording will be sent out to all attendees to watch at your own pace. Pause as you need to, so don't worry about taking notes during these steps. If we go to setup and charting setup and template design, before I select a template, I will say that this is where we need to be extremely careful not to touch anything within the template, as it will cause those changes to occur retroactively as well, potentially deleting data. Should that happen, stop what you're doing and call tech support. They will be able to help you. So that being said, we're going to click on select template. We are going to edit an existing, click next, find the template we want, next and finish. This is where you do not touch anything. We are going to click the defaults button at the top here. It opens up a secondary window. I will move it to the side just for safety's sake. So here you can click on new and generate a title for your default template. Then add in any predefined text that you want within the note and click save. You can also add in form fields. That allows you to pull in information from elsewhere on the chart. For example, if I place my cursor where I want to pull in the information, I'm going to click on this Form Fields button and select the section of the chart that I would like to pull from. In this case, I will go to the Labs section and check for my hemoglobin A1C value and the date. And then I will click OK. And then I'm going to just put a comma and a space between those two so that it looks better. Then I will click Save, and you can then click New to generate more. As you see, I have a variation of different ones regarding different items for the same soap note. Then you can close this window and save and close this design window as well. And now you are ready to use those chart templates with defaults on a patient's chart, as I showed previously. So back in the patient's chart, the next thing I'm going to talk about is the reference panel. This is a great tool and can be found on the right side of a patient's chart. It's a quick visual of all sections on the chart while completing documentation. To open this, if it's not already open, you click this Show Reference Panel button in the top right-hand corner. Once it's open, it will stay open when you move from patient to patient until you close it with this X. This can be customized on a per user basis, clicking the settings tab at the top here. You can highlight and move it to hide the sections, or you can also select an item here and change the ordering using those arrow keys as well. Click OK. And this will maintain your settings from one patient to the next. And it's beneficial to sort based on your specific needs and what sections in the chart you use within your clinic. So there are 4 sections in the reference panel here. We have problem history, latest lab values, medications, and patient messaging. Each of these entries have 6 little dots next to them. This allows you to drag and drop into chart notes or forms for ease of documentation and reference when discussing in a visit or adding detail. We do also have the function that allows you to right-click on the meds, problems, and labs, and it will allow you to drag and drop those items into your chart note or form as well. So as I mentioned, we have a patient messaging section in the reference panel. I am going to go into a little bit of detail regarding the patient messaging. Patient messaging is a secure platform that allows patients and clinics to communicate electronically without leaving Healthquest. Some of the benefits include it being a billable service. You can send patients quick messages that are documented on the patient's chart, unlike a phone call followed by a work list documenting that same phone call. You can send attachments such as requisitions or copies of results, saving patients from having to come in and collect or a clinic mailing out. You can also skip the middle person, removing the chances of misinterpretation when messages are shared through work lists and other people, and then patients asking additional questions on top, causing potential for misinformation. And additionally, you can also send out batch messaging to all patients that meet a specific criteria. For example, if you need a group of patients to complete a specific intake form, you can send them a generic message advising them to complete the attached intake form in the time it takes to send one message. There are 3 options on how your clinic is set up with patient messaging. You can have one-way communication, sending out messages to patients to share information. Secondly, you can allow them to reply to a message if you were to leave that conversation open. This is the most common setup that we've seen, as you do have the ability to prevent a reply on a case-by-case basis by closing that conversation. And the third option is you can have full 2-way communication where patients can even initiate that conversation as well. So if we go back to our patient's chart here, and on the patient messaging tab on the end, you can create new conversations and manually type in a subject as well as typing in your message. You can also use a pre-built template. If you right-click in the message box, I am going to use my intake forms template that I have created. As you can see, I have an intake form that is already attached as part of that template. You can also manually attach items. If you click the attach button, you can attach anything from the patient's chart. You can also add a new form if you have form templates that have testing already checked off. And you can also add intake forms individually as well for electronic completion by the patient. You would then click send. The patient is then going to receive an email advising that they have a message in the portal and to log in to access that message. As I showed using templated messaging, I will show you how you can create them. If you are on the patient messaging tab in the patient's chart, you can click this response setup, or you can go to the setup menu at the top and patient messaging response setup. This allows you to generate new categories that you can see in bold on the left here, allowing you to categorize some of your responses. And then when you click on new response, you can then give it a title, make sure that there is a subject. And then in the text, you can enter the text as you see fit. And in this example, obviously I have used form fields as well. So if I was to delete this, if I have my cursor where I want a form field, which is pulling in that patient information, I can click this little green icon here, and I can pull anything from a patient's chart, but obviously in this case, I'm going to look for a patient first name, click OK, and it will enter that form field, just making it more personable. Once you have entered everything into your text field, you can also add attachments to these templates. You can add intake forms with the paperclip icons down here, or requisitions forms if you have those testing pre-checked off. Any additional attachments that you would make here would either be off your generic patient handout information, or it would be patient specific, so you would add that in the moment of sending the message. Then you click save, and then you are ready to use that patient messaging template. You can use that in the patient's chart. You can also use that in the doctor view. The doctor has a tab at the end, -1 for prescribe it. You have patient messaging, and then you can create a new conversation from here as well. So the last thing I'm going to show you is using macros for billing. If you always use the same service codes, modifiers, and diagnostic codes together all the time, it may be easier and faster to type in a macro, so all those items populate for you. So back in a patient's chart note, I am going to enter my macro, and I will click enter. You may not have seen anything here, but as soon as you click that bill button, it will expand out that information. You can also do the same thing if you are not in a chart note and you click on new claim, select your doctor, your patient, and add today's date. In the service code, again, you would just do the macro and it will populate out all of those details. I will close out of that. So to create these Alberta Health Claim macros, if you go to the admin menu at the top here and go down to AHC Claim Macros, you click New at the bottom here, and if it's specific to you as a provider, select yourself in the doctor dropdown. If it's generic for a whole clinic, you can just leave this doctor blank. Enter in the macro that you want to type in, and then add in your service code, diagnostics, any modifiers that you need to as well. Click on save. Then you are able to utilize that macro moving forward for billing. I will close out of this one. And you can also do the same for staff that are billing patients or third parties as well. If you go back to the admin menu and client billing macros, it's the same idea. You'd click on new, generate a macro code, enter your description, limit it to a specific provider if you want to, and enter in your pricing entry with the amount. Click save. When using that for billing a third party or a patient, click bill client. I'm going to select my doctor, my patient, and my third party here. So then in my code box here, I am going to type in my macro, and it will populate the description information and the amount that I need to complete that invoice. So that brings us to the end of our tips and tricks today. If you have any questions on the things that we have shared today or in general, you can click F1, or you can click the help menu at the top, online help, and if you have a window open, it will actually take you to that help file related to the window that you have open. So hopefully we have shared some tips and tricks for you to speed up some workflows with patients. So we will now open it up to Q&A. And in just a second, you will see a poll popping up on your screen. Please take a quick moment to complete sharing your feedback on the webinar today. Thank you everybody for your time.
Okay, so we can start going through the questions in the chat here. I'll just launch that poll. So Shauna just asked, when and where will we be able to find the recording of the webinar? And so we will send it out through email to everyone who is registered today. It's also in our knowledge base under the webinars section, or it will be. And then they're also hosted on our YouTube channel. And I'll just go farther up in the list of questions here and see what we've got. So there was a question earlier about the Nexus integration and which Healthquest version. If you still have to copy and paste, I believe that it came out in 4480, but it might have been a version or two after that. So if yours does not automatically generate the chart note once the visit is complete, then you can contact support and they can work their magic to get that working for you. The patient consent form for AI, it is an intake form. So if your clinic has intake forms enabled, it is in the public library for those. If you do not have intake forms, currently that's the only one that we have in the system, but they can always be added as a regular patient form as well.
And just to note, if you don't currently have intake forms, you can definitely reach out to your account manager and you can have that discussion with them as well for that feature.
Thank you. And then we were also asked about the patient messaging, if it was only sent out by email. And Nicole gave a really great answer in the chat here. So secure patient messaging is only done through the patient portal, which patients need to log into in order to see the message. They will receive an email notification that they've received a new message and must log in to see it. Patients must be invited by the clinic to have access to the portal. And again, this is also an additional feature, so you'll have to contact your account manager if you don't have it available, or have your clinic manager reach out. For patient messaging, is it currently used by other clinics? We do have quite a few clinics with it enabled. The settings that they have are going to vary clinic to clinic with that one or two-way messaging. Some of the clinics do like to just have the messages sent out to the patients where they can't respond to them. They need to call if they have anything. Other ones like to leave it open. And I have gone into a few clinics where they do have the two-way communication open, and they seem to really like having it. You can set a staff member, delegate them to distribute the messages as needed so that they're not all just going to the providers. There are ways to make it work well for you and your team. Reception from patients on patient messaging. I would think that patients like it. I like it as a patient, but I think the ability to receive documentation from your clinic is really valuable. You're able to receive your requisitions like this. They can send you your results. You can have kind of that private conversation with your physician or provider digitally, which eases that access a little bit. I think that it's pretty great to have. And someone else here does have the two-way communication open, and the receptionist directs it if appropriate. So that's nice. Team-based approach.
Awesome. Yeah.
Yeah. So if there's any more questions, throw them out there. Our next webinar, we're looking at external communications tools, most likely around the end of April. And yeah, throw your feedback in the polls. If you've got more topics that you'd like to learn about, let us know.
I'm just reading a question in the Q&A here as well, really quick, Stephanie.
Oh, okay.
For default templates, are we able to use a default template while still copying over the chart notes from the patient's previous exam? For example, if they were seen for a diabetic exam last week and this visit is for a glaucoma exam, can we use the glaucoma default template while copying a previous doctor's notes? It's a good question. Depends on how your templates are set up. If you have the same field name that is, now I'm double guessing myself. Let me double check that one for you and I will get back to you on that one.
And then there was a question in the chat, but I clicked the Q&A and now I can't see the chat anymore. Has there been a recent webinar on Prescribe It? Not that we've hosted. I think the last one was maybe a year or two ago, but we can certainly throw it into our list of content for the year. And Sam, so for the AHC macros, how do you do it so that the facility and the functional center stays blank, for example, when using the 0303NB code?
When using that code, does it automatically fill those fields in? Because if it doesn't, I know in the example that I sort of shared, yeah, it does.
Yeah.
Okay. Unfortunately, I don't know that there's a way that we can delete those fields once they've been filled in, kind of thing. Like I
Nicole
have some
said
in other.
it may need to be configured in the doctor's profile.
Okay. There you go. I will make a note of that and we will definitely get back to you on that one as well, regarding that.
Okay, awesome. Well, thank you guys for joining us today. I'm going to figure out how to stop the recording, and I guess we'll wrap it up for today. Thanks, and we will see you guys again in a couple months.